We're here establishing a permanent site here in Los Angeles and also at their Kaiser's corporate headquarters in Oakland to confront Kaiser with this simple message. Mental health care can't wait. Kaiser patients and clinicians will not be denied. And we will hold you, Kaiser Permanente, accountable to provide the parity and quality of care that Kaiser patients deserve. The time for action is now. The situation for Kaiser patients is worsening as its mental health services continue to deteriorate. Today we start with a public display of messages from Kaiser patients, their families, and caregivers mounted for all to see. Everything you need to know about Kaiser's mental health care system is written on these panels. There are accounts from patients who had to drop Kaiser and go to Medi-Cal just to be able to see a therapist. There are stories from patients who were referred outside of Kaiser only to call dozens and dozens of private practice therapists, none of whom would offer them an appointment. And there is commentary from people whose spouse or child couldn't get the care they needed and died by suicide. Kaiser has more than enough money to fully staff its mental health clinics and provide the care that its members are paying for and that California law requires it to provide. Yet so far, it has refused. Clinicians have made a straightforward proposal that would go a long way to stop the decline in access to mental health care services and boost the quality of care mental health care at Kaiser. First, Kaiser must provide crisis services at every clinic. Second, ensure sufficient time for clinicians to perform vital patient care duties beyond treatment appointments so they don't burn out and leave Kaiser even more understaffed. Third, guarantee that most new hires will be full-time, fully trained, who can address the long wait times for return appointments. And finally, provide Kaiser Health clinicians with the same cost of living adjustments and benefits of every other unionized Kaiser worker. Kaiser's inequitable treatment of mental health care workers can't be explained by anything else other than discrimination against them and the patients they serve. We will be here every day going forward until Kaiser executives finally confront the truth and fix its mental health care system. We urge Kaiser Health Plan executives and Permanente physicians to re-engage with us and work to come up with an equitable solution to its mental health crisis. Thank you all so much for being here today.